Parathyroid disorders. First question. You're assessing a patient with hypoparathyroidism. Which of the following findings would you expect? Would it be hypercalcemia and bone pain? Would it be tetany and muscle cramps? Would it be increased thirst and frequent urination? Or would it be weight gain and fatigue? So we're talking about hypoparathyroidism. What would you expect to see in your patient? Great. Tetany and muscle cramps. So let's talk about this, guys. Remember when we did the Kahoot and we were talking about thyroid, not parathyroid, thyroid disorder. And I told you when you think about the thyroid, I want you to think about metabolism. If the patient has hyperthyroidism, metabolism's increased. If they have hypothyroidism, metabolism is decreased, right? Well, when we're thinking about the parathyroids, I don't want you to think about metabolism. I want you to think about calcium in the blood. If the patient has hypoparathyroidism, the calcium in the blood is low. The patient has hypocalcemia. If the patient has hyperparathyroidism, you should expect the patient to have hypercalcemia. Now, this part is very important. You can't only remember the calcium part, you have to remember in the blood, because usually you think of calcium, you think about calcium in the bone. That will mess you up and you will get the answer wrong. Okay, so we're talking about parathyroidism. We're talking about calcium in the blood. Calcium in the blood either being high or calcium in the blood being low. Something important you guys have to understand. You guys got to know the normal calcium level. That is 8.5 to 10.2. 8.5 to 10.2. If the patient has hypoparathyroidism, they have hypocalcemia. What does that mean? Their calcium level in the blood is less than what? 8.5. What are symptoms of hypocalcemia? Right there, you're looking at it. Tetany, muscle cramps, paresthesia. Okay, those are the signs and symptoms that you see in hypocalcemia. Let's look at the other options. The first one, hypercalcemia, bone pain. What would we see that in? Obviously, guys, we'd see that in hypercalcemia, hyperparathyroidism, not hypo. How about increased thirst and frequent urination? We'd see that in a patient with hyperglycemia, right? You'd be thinking polyuria, polydipsia, polyphagia. And last, weight gain and fatigue. We'd see that in what? We see that in something like hypothyroidism when we were talking about metabolism. But in hypoparathyroidism, we're talking about hypocalcemia. Signs and symptoms of hypocalcemia, again, tetany, muscle cramps, paresthesia, that tingling sensation. Which statement about calcium supplementation by the client indicates a need for further teaching? I'll take my calcium supplements with food. I need to take my calcium supplements consistently every day. I should avoid eating spinach or rhubarb near the time I take my calcium. Or if I feel tingling in my lips, I should skip my calcium dose. Which statement requires further teaching? Everyone that loving the live, thank you. Everyone that double tapped on the screen, thank you. The correct answer, if I feel tingling in my lips, I should skip my calcium dose. Think about it. I just told you what that paresthesia is, right? So that tingling in the lips, that's a sign and symptom of what? Hypocalcemia. Patient's calcium level is low. Why would they skip their dose of the calcium supplement? They need that calcium. If anything, they need to take that calcium supplement and notify the healthcare provider. All of the other options are correct. These are good things to do. That's why it doesn't require further teaching. Okay? You're caring for a client diagnosed with hyperparathyroidism. Which symptom is the client most likely to report? Would it be muscle rigidity? Would it be constipation and fatigue? Would it be hypotension and bradycardia? Or would it be frequent urination? We're talking about hyperparathyroidism. Wow. Guys, let's talk about this. Wait a minute. 61 of you guys went with muscle rigidity. First of all, muscle rigidity, we could see then stuff like if the patient were to have like stiff person syndrome, where they go from like muscle rigidity to muscle rigidity, muscle spasms, but not hyperparathyroidism. Think about it. Hyperparathyroidism is what? Hypercalcemia. So you need to be thinking of those signs and symptoms of the calcium being too high. Where? In the bloodstream, guys. Constipation, fatigue, bone pain, kidney stones. Because of all that calcium, what do you think the calcium does? It clumps up. Okay? Hyperparathyroidism equals what? Hypercalcemia. We're looking for signs and symptoms of hypercalcemia. It would be constipation fatigue. Also, constipation fatigue also could be a symptom also of Cushing's. It could also be a symptom of hypothyroidism. Be very careful. Do not confuse hypo and hyper, thyroid and parathyroid. There is a difference between the four. Make sure you know the clinical manifestations of each. Okay? Hypotension, bradycardia, we could see that in hypothyroidism. You could also see that in other disorders as well, but not hyperparathyroidism. We're talking about hypercalcemia. Frequent infections, we'd see that in what? Anyone that's immunocompromised. A client has undergone a parathyroidectomy. Which post-op finding requires immediate intervention? Would it be a calcium level of 8? Would it be mild hoarseness? Would it be decreased urine output? Or would it be tingling around the mouth and fingers? So your patient just had a parathyroidectomy. What would cause you to call the healthcare provider right away? Very good. Tingling around the mouth and fingers. What does that let you know? Most likely this patient's hypocalcemic, right? But it's more serious than that. The patient just had the parathyroids removed. When you're thinking of parathyroids, what did I tell you to think of? Calcium in the blood. If the parathyroid gland has been removed, you expect that calcium in the blood to go what? Down. Think about all those signs and symptoms of hypocalcemia. Muscle nerve irritation, spasms, right? So that tingling in the mouth, that may be just that may just be foreshadowing what's later to come, a complication that's even worse, such as what? Seizures, cardiac dysrhythmias, laryngeal spasm, that patient's airway closing up. Who cares about anything else if that patient can't breathe? Right? So even though all of these are an issue, calcium level of 8, that's lower than normal because normal is 8.5 to 10.2. So that's a problem. Decrease urine output. You're supposed to be releasing at least 30 mLs of urine an hour, right? If you're not doing that, that's a problem. And mild hoarseness. Of course, that's a problem, but which one's going to be a priority? Whenever you think about priority, you're going to think which one's a medical emergency, which one can harm your patient in the worst way. It's that tingling around the mouth and fingers because you know what that means. Okay, we are concerned about the complications that can occur from the hypocalcemia because, again, hypoparathyroidism can lead to hypocalcemia with very severe results. Okay. You're providing dietary teaching to a patient with hyperparathyroidism. Which food should the patient be encouraged to limit? Would it be fresh fruits? Would it be milk and cheese? Would it be lean protein? Or would it be whole grain bread? You're teaching a patient with hyperparathyroidism. What type of foods would you teach them to limit? We have over 100 people in this room. Come on, guys. Don't be shy. Very good. Milk and cheese. Think about it. If the patient has hyperparathyroidism, they have hypercalcemia, right? Do you think it's a good idea for them to be eating foods high in calcium if their calcium levels already increased to begin with? No. So we're going to teach them about the types of foods not to overindulge in foods high in calcium, such as milk and cheese. Fresh fruits, we love fresh fruits, full of fiber, helps empty the bowel. Lean protein, we love protein. It helps you build muscle. It helps with wound healing. Whole grain bread, we love that. It's high in what? Fiber, right? Joshua, you're an amazing teacher. Thank you, Joshua. Thank you. All right, you're teaching a patient about her new prescription for calcitriol. Which statement by the patient is correct? This medication will help lower my potassium levels. Calcitriol helps my body absorb calcium from my diet. I should take this medication only when my calcium levels are high. Or this medication works to increase my blood pressure. Which one is correct? Very good. Calcitriol helps my body absorb calcium from my diet. Guys, this medication is the active form of vitamin D. What does vitamin D do? It helps you absorb calcium. You can take as much calcium as you want. You want to make your bones strong, you're taking calcium, great. But if your body can't absorb that calcium, it's not going to do anything. It's not going anywhere. What do you need to absorb calcium? Vitamin D. Calcitriol is the active form of vitamin D, guys. Okay, it does not lower your potassium levels, so that's wrong. Look at the next option. I should take this medication only when my calcium levels are high. What is the one word, guys? What is the one word in that answer choice that made you know that was wrong? Quickly, quickly. Thank you. Only. The minute you saw only, you should have said and kept it moving. Next, this medication works to increase my blood pressure. No, it doesn't. Absolutely not. Again, it's an active form of vitamin D. It helps you to absorb calcium. Which of the following statements about parathyroid hormone indicates an accurate understanding? It increases the absorption of calcium from my bones into my bloodstream. It reduces my blood calcium levels by promoting bone formation. It works to eliminate excess calcium through my kidneys, or it is responsible for reducing calcium absorption from the foods that I eat. What do you guys think? Very good. It increases the absorption of calcium. Here's the important part, guys. From my bones into the bloodstream. So, what is this medication good for? What is this hormone good for? That patient that has hypocalcemia, and we need to bring up that blood, not bone, blood calcium level, right? Or get some of that calcium that was in the bones and bring it back to the bloodstream where it belongs, because we need a normal level of what? 8.5 to 10.2. That is your therapeutic range. You're providing discharge teaching to a patient with hypoparathyroidism. Which statement indicates a need for further teaching? I will include more dairy products like milk and yogurt in my diet. I need to take my calcium and vitamin D supplements as prescribed. I should report any numbness or tingling in my hands or around my mouth. I can skip my calcium supplements if I feel fine. Which one requires further teaching? By the way, while you're looking at this picture, you see those 4 dots? 1, 2, 3, 4. These are your parathyroids. And this big thing right here, that is your thyroid gland. So this is your thyroid, and those 4 little dots, those are your parathyroids. Okay, so anyway, you're teaching a patient with hypoparathyroidism. Which one requires further teaching? Again, when the question asks you what requires further teaching, what you're really being asked is which one's the wrong answer, which one's the wrong thing to say. And I can skip my calcium supplements if I feel fine. It doesn't matter how you feel. You may feel fine, And guess what? Your calcium levels are low. You just haven't started showing any clinical manifestations yet. So you need to take your medication as ordered so you can have a steady stream, a steady dose of that medication in your body. Everything else is correct. If the patient has hypoparathyroidism, what that means is that they have hypocalcemia. Hypo, low, calcium, emia in the blood, low calcium in the blood. So including foods like dairy products, milk, yogurt, that's a good thing. That doesn't require further teaching. Taking the calcium and vitamin D as ordered, that doesn't require further teaching because remember I said, guys, it's not enough just to take calcium. Your body needs to be able to absorb it. So you're going to take calcium and vitamin D because the vitamin D is what makes you absorb the calcium. And last, I should report any numbness and tingling in my hands or around the mouth. You better, because those are signs and symptoms of what? Hypocalcemia. And guess what? There may be some more serious complications behind, including what? Laryngeal spasms. We don't want that patient's throat, airway closing up on them. We don't want them going to seizures. We don't want them having cardiac dysrhythmias. Live visibility restricted. Your live is not eligible for recommendation and restriction in search results because it may contain unoriginal or reproduced content. I made up these questions myself, by the way. This is in line with the give me a second, guys, because I'm about to have to appeal this real quick. No. These people are a hot mess sometimes. Yes, I literally made these questions like, what are they talking about? All right, moving on. Moving on. What was I saying to you guys? Okay, we are talking about hypoparathyroidism. Okay, so anyway, the point is, guys, even if you feel fine, that does not mean that your calcium levels are not lower than what they're supposed to be, and we need a steady stream of that calcium, of a therapeutic range of calcium in your blood, okay? We want it between 8.5 to 10.2. True or false? Severe hypocalcemia and hypercalcemia have occurred with the use of parathyroid hormone. Is this true or is this false? If a patient were to take parathyroid hormone, PTH, they have been known to experience both severe hypo and hypercalcemia. Is this true or is this false? Are you going to be watching out for severe hypercalcemia? True. It absolutely is true. You know, there are lots of medications. You may see a paradoxical, an opposite effect of what you expect that drug to do. And unfortunately, parathyroid hormone is one of them. PTH absolutely is one of them. So if patients on PTH, you better be watching out for both severe hypo and hypercalcemia. All right, last question. Hypercalcemia is contraindicated in the use of parathyroid hormone. So if the patient's taking parathyroid hormone, it is contraindicated for them to have hypercalcemia. If they have hypercalcemia, they should not be taking parathyroid hormone. Is this true or is this false? True. Think about it. Hypercalcemia. The calcium level in your blood is already elevated. You think that's a good idea? Does that make sense to you? Right? So, yes, being in a hypercalcemic state, that is contraindicated to the use of parathyroid hormone. Not too much on the nurses. Someone said, I'm wondering how many nurses are playing. I thought you said, why are so many nurses playing? All right, nurse lady. Sorry, I was right about to say not too much on the nurses. Okay, guys. Everybody that was part of this Kahoot, I'm so happy this Kahoot is over because TikTok is starting to work my nerves. Everybody, that's watching this video, if you're watching on YouTube, please let me know in the comment section if you would like to see more content on parathyroid hormone. I will be glad to make more content. Let me know in what format you'd like to see it in. Would you like to see it in a Kahoot format such as this? Would you like to see it in a lecture format, or would you like to see it in a Q&A format? Okay. Thank you so much for watching. And don't forget, guys, you can find me covering nursing topics across all social media platforms: TikTok, Instagram, Facebook, YouTube. I'm the same everywhere. Nexus Nursing. That's my handle. All right, guys, let's see how you guys did.